Hi, my name is Nicole and I'm a physical therapist here at Sullivan Physical Therapy, and today I want to talk to you a little bit about what to expect on your first appointment. So it's best to arrive 10 to 15 minutes early so that we can ensure all of your paperwork is filled out and we can start your appointment on time. Once your paperwork is filled out, your therapist will then bring you from the waiting room to a private treatment room. Once in the individual treatment room, your therapist will then begin to ask you questions about your symptoms such as pain levels, bladder function, bowel function, and sexual function. Following that, your therapist will likely explain a little bit more about the pelvic floor, what it is, and how that may relate to the symptoms that you're having. Your therapist will then move into the exam portion of your first appointment, which will vary from person to person. So your therapist may want to look at general range of motion of your spine or hips, and then will likely include some form of a pelvic floor assessment. Now, the pelvic floor assessments will vary from person to person again, depending on your symptoms, as well as tailored to each patient's comfort level. So generally, your pelvic floor therapist will want to look at the external pelvic floor muscles first, which is the most superficial layer or top layer of the pelvic floor, where they can assess for muscle tone and tissue quality. Following that, your therapist will want to perform an internal exam if indicated. And so this can again vary from person to person. So for males, it would be a rectal exam, and for females, could be a vaginal or rectal exam. There, your therapist can look at muscle tone as well as assess muscle strength and endurance. Following that, your therapist will leave the room, allowing you to change, and then return and explain what they found in the exam, as well as provide you with their treatment plan. You'll then have the opportunity to ask your therapist any questions about their exam findings or their treatment plan and how frequently they want to see you and how long they expect to see you. Following that, you will be finished with your appointment and you can walk back out to the front and check out at our front office and make sure you have some appointments scheduled with us. And then we will see you at your next appointment. We look forward to meeting you and we can't wait to have you in.